This is Dr. Caudle Miller with Dr. Miller's Guide to Clinical Neurology, and today we're going to talk about the prophylactic treatment for migraine headaches and tension headaches. We're going to talk about the medicines you use to help prevent headaches. And we talked about this briefly in the video on headaches, but there are 4 different pathophysiological mechanisms that occur when a patient has headaches. And the first one is vascular. You know, there's a constriction of the blood vessel, then a vasodilatation of the blood vessel. So if I'm convinced they have a migraine, I first look at this first group of drugs and see if patients are a candidate for them. The first drug is Inderal. Inderal has been used by millions of Americans, millions of people across the world for migraine prevention. It's very safe. It's safe in pregnancy, safe cosmetically. So young people with nice hair, nice skin, it's very, very safe. And it just works great. It takes time to work. That's the negative about it. It can take 3 to 6 months for it to really kick in every time you change the dose. So you have to be very, very patient with it. But the thing about Inderal, you could take it forever. And there are some negatives. You know, you cannot take it if you're an asthmatic. You know, can precipitate an asthmatic attack. You can't take it. If you're diabetic, it can mask hypoglycemia. It can cause sexual dysfunction in men. So we don't use it in men that are sexually active. You don't use it in people that are bradycardic, and any kind of heart condition. You know, we don't put people on Inderal without talking to their cardiologist. So Inderal is the drug of choice in this particular class, treating the vascular headache. The second drug is verapamil. And verapamil is a wonderful medication that we use in just certain types of people. For example, a man, you know, who's bald, African-American, has hypertension and migraines, your verapamil is a great choice, and you can change, you know, your, antihypertensives and switch them over to verapamil. Doesn't have a lot of side effects. It can cause some constipation, cause a little bit of a tremor, but it's very, very good. Another blood pressure medicine we use for migraine prevention is Atican. It's an ARB. It's a good first choice for hypertension. So once again, it's a drug we may use in someone who has hypertension that has migraine. Now the biochemical mechanism for headache is treated with different classes of drugs, the antidepressants. So when you get a constriction of the blood vessels, vasodilatation, you get a release of chemicals, and we use antidepressants. Now most neurologists don't treat depression. You know, so we use antidepressants a lot for pain. We use them for neuropathic pain. We use them for headaches. You know, my favorite one is Pamelor. You know, for 50 years we've used Elavil for headaches, and Pamelor is another tricyclic antidepressant that may not have quite the baggage Elavil does. You start at very, very low doses. You know, one thing, we're not treating infection here. We're treating headaches, and you have a limited opportunity with a limited number of drugs for each patient that will fit that patient profile. So always start with baby doses. So Pamelor, you start at 10 milligrams to 25 milligrams and increase gradually. And we'll talk about the drug in its own video. Elavil is still a good choice. A real elderly patient who weighs 90 pounds that can't sleep. We sometimes use dizipramine. Cymbalta is a great choice. You know, Cymbalta increases serotonin and norepinephrine. I really thought we'd see more drugs like it because it increases both serotonin and norepinephrine. Another good medication. Effects are great medicine for headache, particularly in girls, men that have anxiety. Wellbutrin is also a good medicine if they have no family history of seizures or bulimia. So the electrical aspect of migraine, when you get the constriction of the blood vessel, vasodilatation, release of chemicals, then a sort of a tsunami, a tidal wave of energy across the brain. You treat the third mechanism with anticonvulsants. You know, by far the top 2 that we like are Topamax and Keppra. You know, Topamax you don't want to put on people in school. Their grades can drop, you know, 1 whole grade, and then 6 weeks later it'll come back. But you want to wait till the summertime. Try not to use it on kids and people in school. Keppra is a great choice. So I would say the majority of the anticonvulsants we use right off the bat are Topamax or Keppra. Keppra has sort of an idiosyncratic reaction or behavioral issue, and people can act really nuts. And we'll talk about this on the Keppra video. Depakote's great. You know, in that same black man who's bald with hypertension, Depakote may be a great drug for migraine. Vimpat is another good choice. Zonogram is another good choice. And sometimes gabapentin and Lyrica. And then The final group of drugs are the trigeminal system activation drugs, the monoclonal antibodies, and the Gepants, and we'll talk about those in another video. So essentially, you want to try to decide, how you're going to pair up the patient's history, their body habitus, with the class of drugs you're going to use. So for example, if I had an 18-year-old white female who's thin with beautiful long black hair, single, Inderal would be a perfect choice for her because she can grow through, that age group where she has children. It's safe in pregnancy, safe in breastfeeding. If I have a 40-year-old white or black female who's 40 pounds overweight, has tension headaches with transform migraine, Topamax would be a good choice because Topamax is not really weight neutral, may help with weight loss. So we try to match the drug up to the patient and their clinical history. Now say that same 40-year-old white female who's a little bit overweight who has tension headaches, we put on Topamax. They transform to migraine. She'll have a pressure-like pain. Then becomes a throbbing, pounding pain once a week or twice a month with nausea, vomiting, photophobia. We may come back to the first class of drugs. We may put her on Inderal and Topamax. So sometimes there's combination treatment for prevention. So we're going to talk about the monoclonal antibodies and the Gepants in another video. We'll talk about Botox in another video. But this is a good start on the treatment of migraine. Now I'm also going to do a series of videos on each of the drugs I just mentioned in this video. So for example, if someone puts you on Topamax, so watch the Topamax video. So thank you for watching. Like my video, subscribe to it, make a comment, and we will see you next time.